이제 곧 시험이 진행됩니다. 헬스 어세스먼트 클래스 컴프리헨시브 체크업인데요. 미국은 이제 주치의를 만나러 가면은 체크업을 아무 병이 없어도 헤드 투 토까지 체크업을 받는데요. 기본적인 정보를 기입하기 위해서 하는데 이제 이번 클래스에서는 이제 어덜트 체크업을 할 거고 저희 남편이 제 바디가 돼서 제 가상이 이제 환자가 돼가지고 그걸 헤드 투 체크업 하는 거를 이제 교수님이 줌으로 이제 계속 라이브로 보시면서 점수를 매기는 거고요.
Alright, so what's going to happen after you take a couple of deep breaths, I'm going to put 50 minutes 50 on the clock, and whenever you start talking, I'll hit start. If I can't see something or hear something, I'll unmute myself and let you know. Okay? You have any questions?
No.
Okay, all right. You can start whenever you're ready.
Okay. Hi. My name is Minnie. I'm going to be your nurse practitioner student today. We're going to go ahead head to assessment. Would you tell me your full name and date of birth, please?
Yeah,
Okay. Patient is Eric. Patient is 39 years old Caucasian male and appears to be staged age. And how are you feeling today?
Good.
Good. Could you tell me today's date and the time, please?
It's October 29th, and I believe it's around 4 p.m.
Okay. Patients well-groomed, communicate effectively, and maintain eye contact well, and calm and cooperative, alert and oriented to person, place, and times. Okay, I'm going to assess your skin first. Okay, let me take a look at your skin. Skin is a light tan and no lesion, no edema, no erythema is noted, no piercings, no tattoos are noted right now. And let me check your skin triggers. Okay, skin trigger recoil immediately, and I'm gonna check your nail band firm attached and pink in color and symmetric. Could you make it a diamond with your fingers and all 10 fingers, please? Good. Fingernail angle 160 degree, and no sinuses, no ridging, no clubbing, no pitings are noted. And I'm gonna check your capillary refill. So raise your toes, please. Okay, the other side. Okay. Capillary refill less than 2 seconds bilaterally. Okay. Now we're gonna take a look at in your hair. Okay. You see your hair. Okay. Light blonde terminal hair is well distributed. No loose of hair spot or no infestations are noted. And on scarf, no tenderness, no messes are noted. And on his scar, I'm noticing cherry angioma. So I'm going to measure this. It's 0.3 millimeters in diameter and smooth surface and red papules and diverse size over scarf, like scattered over a scalp. Okay? Now I'm going to take a look in your head shape. Head, normal cephalic, round and midline upright and still, and facial features are symmetric. And no tick or no tremors are noticed, and fine blonde vellus hair over the face, and neck no fullness, and mid trachea in midline. Okay, so I'm gonna palpate your thyroid. So take a sip of water and hold it in your mouth. Okay. I'm gonna palpate from behind you and then swallow just a little bit. Good. And then rotate your face. Swallow it. Good. And the other side. Swallow it. Good. Okay. I'm gonna take a listen, your thyroid. Okay. Thyroid moves smoothly while patient swallowing and no tender or no palpatable noted and no bruits. And now I'm gonna take a carotid pulse, check it. Good. Okay. And one more time, we're gonna take a listen, your carotid. Carotid pulse, regular rate and rhythm, and no bruits noted. Okay. Now we're gonna check your facial cranial nerve. Okay. So clench your both teeth for me. Good. And one more time. Good. And we're gonna this is sharp sense and this is dual sense. Okay. And close your eyes and tell me if it is sharp or dual. Okay.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay. Open your eyes for me. Cranial nerve 5, number 5, trigeminal nerve, motor and sensory nerve intact bilaterally. Patients are temporal and masseter muscle contract equally bilaterally, and sensory patient able to sense sharp and dual sensation and light touch over forehead, bilateral cheek, and chin correctly. And now you're gonna follow my lead and raise your eyebrow for me. Good. And close your eyes. I'm gonna try to open your eyes and keep closing. Good. And then open your eye for me. Okay. Show me your teeth. And puff your cheek. And purse your lips. Good. Are you able to differentiate flavor of a salty and sweet?
Yes.
Okay. Cranial nerve 7, facial, motor and sensory nerve intact bilaterally. Patient motor, patient able to make all those facial movements symmetrically bilaterally, and sensory, patient able to differentiate sweet and salty flavor on 2/3 of anterior tongues. And now I'm gonna press your shoulder down. You still want to shrug your shoulders, okay? Good. And then turn your head. I'm gonna push, but you still want to turn your head against me. Good. The other side. Good. Okay. Cranial nerve 11, spinal accessory nerve, spinal accessory motor nerve intact bilaterally. Patient able to contract trapezius muscles to shrug his shoulder against the resistance, and also patient able to contract the sternocleidomastoid muscles to turn the head against the resistance as well. Okay. Now we're gonna check your eyes. Oh no, lymph node. We're gonna check your lymph node. Okay. Look at me. Occipital, postauricular, preauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical. Show your shoulder for me. Supraclavicular. Put your shoulder on my head. Okay. Truncular. Bring up your t-shirt. axillary. Okay, all lymph nodes are non-tender, non-palpatable bilaterally. Okay, now we're gonna take a look at your eyes. Okay, looking at me. Eyelids are symmetric, eyelash and eyebrows are evenly distributed. I'm gonna feel your eyeball, okay? Close your eyes. Eyeballs are firm. Lacrimal apparatus are soft. Open your eyes for me. Irises are green. Eye lenses are clear. And scleras are white. And conjunctiva are clear. No exudate, no erythema noted. Bilaterally, okay? Now, we're gonna do the vision test. Snelling test is for the far vision test, which you're supposed to stand 20 feet away from the chart and cover one eye and then read the chart and then the other side the same way. But we're going to do the Rosenbaum test, which is a near vision test. And you're going to stand here, 14 inches away, and then read the smallest character. Close your one side of your eyes, left side, good. Read it left to right, please.
L, T, F, P, H.
Okay, and now switch to the side. Cover the other side eye, please, and then read it right to left.
H, P, F, T, L.
Okay, good. So cranial nerve 2, optic nerve intake bilaterally. As evidence-based vision without corrections, OD 2020, OS 2020, OU 2020, and OS 2020. Okay. Now we're gonna take a look into your eyeball. I'm gonna dim the light. And here. Looking at me. Okay, find the red reflex. Can get the closer. Okay. And the other side. Find the red reflex. And getting closer. Okay. Optic nerve, optic disc are well defined margin, retinas are red, no AV leaking, no exudate, no hemorrhage, no teeth, and bilaterally. Now we're gonna take a look into your pupil, okay? Good. 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 Okay. Looking at my fingers, keep following the fingers. Okay. Pearl test perform pupil equal round reflex to light and accommodations. Pupil size 2 millimeter with direction, direct and consensual response bilaterally. Now we're gonna do the corneal light reflex test. Just looking at me behind the one spot. Good. Corneal light reflex is symmetric bilaterally. Okay. Turn the lights on. Okay. Now we're gonna do uncover, cover. Looking at me. Cover. Okay. Cover, uncover test negative for deviation and any eye movement bilaterally. So now you're gonna follow my fingers. Keep looking at it, okay? Left superior, left lateral, left inferior. Right superior, right lateral, right inferior. Good. Patient able to complete the 6 cardinal field test without eye deviation and nystagmus bilaterally. So cranial nerve 3, ocular motor nerve cranial nerve 4, truncular motor nerve, cranial nerve 6, abducens motor nerves are intact bilaterally. Okay, now we're going to move on to the ear. Okay, peanut is aligned with the eye canthus bilaterally, and I'm touching your palpated on your ear. Peanut and the ear lobes are non-tender, no masses, no teeth bilaterally. Okay. Now it's time to take a look into the ear. Okay. Okay. Brace in place and pull back. Okay. Now brace in place and pull back. Ear canals are no arrhythmia and cerebrum, no teeth, and tympanic membranes are pearly gray, no bulging, no retraction, no penetration, no teeth bilaterally, and bony landmarks are intact also bilaterally. The cone of light on the right ear at 5 o'clock and left was at 7 o'clock, no teeth. Okay. And then now we're gonna test if you can hear well, okay? I'm gonna stand behind you and I'll give you a whisper words and repeat my words, okay? Apple pie.
Apple pie.
Could you repeat a little bit louder, please?
Apple pie.
Okay. Maple syrup.
Maple syrup.
Thank you. And cranial nerve 8, acoustic vestibular cochlear, sensory nerves intact bilaterally, patient able to hear whispered words of 2 feet away, from 2 feet away. And now we're gonna test if you can feel a little bit of vibration. Okay. Let me know if you can hear or feeling vibration both ear, okay?
Yes.
Okay. Weber test performed, the vibrations here and lateralize into the both ear bilaterally. And now you're gonna feel a little bit of vibration. Once vibration disappear, raise your hand, and then I'm gonna move this fork in front of your ears. And then once you cannot hear the vibration anymore, raise your hands again for me. Okay. Hold on. Okay. Okay. Rennie test performed. Air conduction was greater than bone conductions. Right ear, 20 seconds over 11 seconds. Left ear, 22 seconds over 13 seconds. Okay. Okay. Now we're gonna take a look into your mouth and nose. Okay. Mouth. I'm looking at your external nasal structures in the midline. I'm gonna palpate. Maxillary sinuses non-tender, and also forehead sinuses non-tender. Okay, and then we're gonna take a look at in your nose. Okay. Place. brace in place. Okay. Brace in place. Okay. Nasal mucosa was pink and moist, and no lesion, no polyps, no arrhythmia or edema noted, and septums are intact. And now we're gonna take a look into the maxillary sinuses. Open your eyes for me. Oh, I'm sorry, open your mouth for me. Okay, and the other side. Okay, also maxillary transillumination intact without occlusions. Okay. Now we're gonna take a look into your mouth. Okay. Lips are pink and moist. And open your eyes for me. Okay. I'm gonna feel it. Okay. Gum and buccals are moist and pink, and there's no lesion, there's no ulceration, no edemas or no teeth. 32 pearly teeth are intact, and no denture caries or no teeth. Okay, good. And could you open your mouth a little bit loud, bigger, and then make a sound for me? Okay. Pharynx mucosa also pink and moist, and uvula, when you say ah, uvula moved up, and then tonsil was a 1+/4+ bilaterally. Okay, and then can you stick your tongue out for me? And move it right and left. Good. Could you stick your tongue out against my force? Okay, one more time. Good. Okay. Were you able to taste bitter and sour, everything without problem?
Yes.
Okay. So cranial nerve number 9, glossopharyngeal nerve, and a cranial nerve 10, vagus nerves, sensory and motor nerves are intact bilaterally. Motor, when patient uvula and then soft palate moves up on phonations, and patient able to swallowing and without difficulties, and also no hoarseness as noted, and gag reflex are intact, and also sensory, patient able to differentiate sour and bitter flavor on posterior 1/3 of tongue correctly. And also cranial nerve 12, hypoglossal motor nerves are intact when patient is able to move tongues symmetrically right each side bilaterally, and also tongue's strength is apparent. Okay. Now we're gonna move on to the chest. Would you take a t-shirt off? Okay. Looking at the chest, suprasternal notch, manubrium, angle of Lewis, clavicular, sternum, xiphoid process, costal angles are symmetric, and chest hairs are brown fine vellus hair over the chest, no lesions or no teeth. And now I'm gonna listen to the percussions, okay? Raise your arm for me. Okay. Resonance sounds are noted on anterior, posterior, lateral chest on percussions. Okay. I'm gonna put my hand over the chest. You keep saying 99, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, thank you. Tactile framing tools are symmetric bilaterally. Now we're gonna take a look, listen to your lung sound. Okay, just breathe normally. Bronchial sounds over trachea, expirations greater than inspirations. And bronchiovestibular sounds over second intercostal space at right and left sternum border. Inspiration equal expirations. And vestibular sounds over peripheral lung area. Inspiration is greater than expirations. And now I'm going to take a listen. Rest of the lung side. Okay, good. All long breath sounds are clear on auscultation without abnormal breath sounds. Okay, now we're gonna take a look into your heart. Heart assessment must be done in 3 positions: sitting, spine, and left lateral recumbent. But we are only going to do on sitting position today. And inspecting on the heart, there's no thrust, no heaves, no pulsations are noted, and palpating on pericardium side, and no thrills or no enlarged heart, no displacements apical pulse noted. Okay, and now we're gonna take a listen to your heart. And auscultation on heart must be done with the bell and diaphragm both sides. Diaphragm is for high frequency sound and bell is for low frequency sound. Okay, I'm gonna do on diaphragm first. Aortic point, second intercostal space at right sternum border. S2 is greater than S1. Pulmonary point, second intercostal space at left sternum border. S2 is greater than S1. Earth, third intercostal space at left sternum border. S2 equal S1. Tricuspid, fourth intercostal space at left lower sternum border. S1 is greater than S2. And mitral point, fifth intercostal space at left mid-clavicular line, and S1 is greater than S2, and also here's the point of a maximum impulse point. Okay, and now I'm gonna listen on the bell. Okay, now we're gonna count your apical pulse for a whole minute, okay? You just relax, okay? typical pulse rate, regular rate and rhythm at 72 beats per minute, noted at 5th intercostal space at the left midclavicular line, and without any gallop, splits, murmur, and rubs sound. And respiratory rate was a 12 breath-downs over a minute, even and equal chest movement, and unlabored breath-downs. Okay. Now I'm gonna palpate your pulse size. Okay. Temporal and brachial and radial and posterior tibial and dorsalis pedis. Okay, or pulse area are checked, regular rate and rhythm, and 2+ over 4+ bilaterally. Okay, now we're gonna take a look into your abdomen. So moving to the sofa, please. Okay. Now I'm looking at your abdomen, and fine brown hair, vellus hairs over the abdomen, and then dry and smooth, and no lesion or no edema, no arrhythmia, or no venous pattern, peristalsis or pulsation noted. Okay. Now I'm gonna take a listen in your bowel sound. Okay, all bowel sounds, active bowel sounds noted over 4 quadrant of the ab and epigastric area, no bruits noted. And now we're gonna do the percussions. Okay, tympani sounds noted over 4 quadrant of the abdomen and epigastric area. And now I'm going to measure your liver. Okay. Clavicular line. And mark it. Umbilical line. And mark it. Okay. Liver span is a 7.5 centimeter, and no hepatomegaly noted or any tenderness noted at 5th intercostal space at the right mid-clavicular lines. And could you turn to the left side? No, right side. And then lift your arm for me like this. Okay. And I'm gonna listen your spleen this time. Okay. Splenic dullness at 6 to 10th intercostal space at the axillary line noted. And now I'm gonna do the palpations on your abdomen. So if you feel any tenderness, pain, just let me know, okay? And light palpation. You okay? Okay, go deeper. Breathe normally. Okay. Abdomens are soft over 4 quadrant of the abdomen on light and deep palpations. And now Would you breathe in? We're gonna check the Murphy sign. Breathe out, and breathe in again. You feel any pain or tenderness? Good. Okay, Murphy's signs are negative. Could you bend your knee for me? Since you're already laying down, we're gonna test your knees. Okay. I'm gonna pull it out. Okay. You okay? Okay. Anterior drawer test is for both bilateral knees are negative. Okay, sit up straight for me and show me your back. I'm gonna check your kidney. Okay. If you feel pain, just let me know. You okay? Okay. CVA tenderness are negative bilaterally. Okay. Now stand up for me. Okay, we're gonna check your muscle and joint. Okay, postures are upright, and when patient walked in, his gait was steady and balanced. So there's no evidence for impairment in mobility. And now we're gonna check the range of motions. I'm going to do it for you, so try not to help me. Okay? Let's just stand over here. Okay. Flexion, cervical extension, hyperextensions, lateral rotations, and lateral flexions. Good. And then here, flexions, extension, hyperextensions, internal rotations, and external rotations, adduction, abductions. One more time. Flexions, extension, hyperextensions, internal rotations, and external rotations, abductions, adductions. Okay. Wrist, flexion, extension, hyperextensions, radial deviation, ulnar deviations. Okay, would you sit down for me? Okay. Ankle, plantar flexions, dorsiflexion, inversion, eversion, adduction, abductions. Plantar flexions, dorsiflexions, inversion, eversion, adduction, adduction. Good. Any pain?
No.
Good. Okay, would you stand up for me? We're gonna do it together now, and we're checking active range of motion, okay? Flexion, extension, hyperextension, lateral rotation, lateral flexation, okay? Flexion, extension, hyperextension, internal rotation, external rotation, adduction, abductions, okay? Now sit down and show me your ankle, wrist. Flexion, extension, hyperextension, radial deviation, ulnar deviations. Good. Now sit down. Show me your ankle. Move. Plantar extension, plantar flexion, dorsiflexions, inversion, eversion, adduction, abduction. Thank you. And stand up for me. Now you're gonna spread out your arm, okay, and close your eyes and try to make a balance for 20 seconds, okay? Starting now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Good job. And now I'm going to check your scoliosis. Okay? Okay. And bend your wrist. Try to touch your toes. Okay? Good. Hip heights are equal bilaterally. shoulder heights are equal bilaterally, and space in between trunk and arms are equal bilaterally. Now you're gonna stand up slowly. Okay? Okay. No evidence for the scoliosis patient when raised slowly without the curvatures. Okay? And now you're gonna sit here. Okay, have a sit. And we're gonna have some fun activities. Okay? Close your eyes and then spread out your arms side by side. And alternatively, we're touching the nose as fast as you can. 1, 2, 3, 4. Good. Okay? Open your eyes. And now you put your hand on your thigh and then flipping, flipping, flipping. Good. Okay. Patient able to coordination is intact. Patient able to touching the nose alternatively, rhythmically, and symmetrically bilaterally without any hesitation. Also, patient able to flipping hand movement symmetrically and then rhythmically bilaterally without any hesitations. Good. And as we previously checked, patient was able to identify sharp and dull sensation and also light touch over his upper extremity and lower extremity bilaterally. And now we're gonna do some vibration test. Okay. First, you're gonna feel this vibration. This is vibration feeling, okay? Now you're gonna close your eyes and then tell me if it is which side and which body part you feel the vibration, okay?
Right elbow, left wrist, left knee, right ankle.
Thank you. Patient able to feel the body vibration on bony parts for upper extremity and lower extremity bilaterally. And now we're gonna check your deep tendon reflexes, okay? We have to compare each side. So for the tricep, okay, Lucifer, brachial, not brachial, bicep. Sorry. Okay. Brachial radialis. Okay, brachial radialis. Okay, scoot in back all the way so you can dangle your knees. Okay. Okay, and Achilles. And then finally, we're checking a Babinski. Okay, so all those deep tendon reflexes are positive and intact bilaterally, and Babinski was negative bilaterally. And then I think that's all.
Okay, you have 16 minutes left. You can look at your card.
Okay. Oh, can I say it now?
Yeah, go ahead and look at your entire card, and if there's anything that you want to show or say, you can say it.
Oh.
After you look at your entire card. Did you look at back and front?
Okay.
Look at it peacefully. You have 16 minutes.
Oh, okay. Oh, okay. I forgot that. And after looking at the nose, and were you able to discriminate all those odors without any problem?
Yes.
Okay. Then cranial nerve 1, olfactory nerves, sensory nerve is intact. patient able to differentiate odors without any problems. And AP2 transfers, could you lift your chest is elliptical and AP2 transfers ratio. Okay, AP2 transfer ratio is a 1 to 2. And that's it. I think that.
Okay, I will stop the clock.
Yep.
14 minutes and 27 seconds left. Okay, perfect. All right, thank you, sir, for helping us out. You may be excused. Great job, Sunman. You definitely passed. Let me just go over some quick feedback and I'll type it up for you.
Okay.